SU23 Intro to Pharmacology, Chapter 10, Urinary Drugs. Chapter 10 covers drugs that impact the urinary system, which includes drugs used to treat disorders of the kidney, bladder, urinary tract, and BPH. The urinary system consists of the kidneys, ureters, bladder, and urethra. The purpose of the kidney is to continuously filter the circulating blood, extracting the waste products of cellular metabolism and excreting them in the urine. The kidneys also filter non-waste substances from the blood, including water, glucose, and electrolytes. The kidneys either excrete these non-waste substances in the urine or conserve them by reabsorbing them back into the blood, depending on the needs of the body. Urine flows constantly from the kidney into the ureters, then into the bladder, where it is temporarily stored. Then urine is released into the urethra during the process of urination. The urethra ends with an opening to the outside of the body in the perineum for a female or the glans penis for a male. This chapter also discusses the closely related structure of the male prostate gland. The kidneys are located in the retroperitoneal space behind the peritoneum, a membrane that lines the abdominal cavity. Diseases that affect the kidneys include nephrolithiasis, which is kidney stones, and pyelonephritis, bacterial infection of the pelvis of the kidney. Drugs used to treat diseases of the kidneys include drugs for nephrolithiasis, urinary antibiotic drugs, and urinary antispasmodic drugs. Other drugs related to the kidney also include diuretic drugs and potassium chloride drugs. Drugs used for nephrolithiasis. Again, nephrolithiasis is the medical term for kidney stone. The main drugs used include alkalizing drugs, alpha receptor blockers, xanthine oxidase inhibitors, and then other drugs. So alkalizing drugs create a more alkaline urine. That's something that has a pH higher than 7, that decreases the chance that crystals will form stones. The drug we use is potassium citrate, which is known as Urocit K. So it's for urinary, we're talking kidney stones, urinary, potassium citrate, Cit K, for the elemental symbol for potassium. Alpha blockers, specifically alpha-1 receptor blocker drugs, relax the smooth muscle layer between the bladder and the urethra. Now, if you recall in the previous 2 chapters ago, I was discussing these alpha-1 blocker drugs and how they impact the relaxation of blood vessels. So smooth muscle, they relax smooth muscle. Here, it's smooth muscle between the bladder and the urethra. It allows a kidney stone to pass more easily. All of the drugs in this category are discussed in a later section because they're also used in treating BPH, or benign prostatic hypertrophy. But we're going to look at the drug tamsulosin, which is known by the brand name Flomax. Flomax, it lets the urine flow to its maximum, and the drug stem is going to be osin for the alpha blockers. Xanthine oxidase inhibitors, I'm going to caution you because I talked about xanthine derivatives with respiratory. Xanthine oxidase is something else. It's actually an enzyme that will oxidize xanthine. So xanthine oxidase inhibitors are going to block the enzyme xanthine oxidase, which would normally help produce uric acid in the body. These drugs are used to prevent uric acid and kidney stones. We also use this in treating gout. So xanthine oxidase inhibitors include the drug allopurinol, which is available by the brand names Xyloprim and Alloprim, but allopurinol. So not only do we use them for kidney stones, but we also use it in treating gout. other drugs for kidney stones. Renicidin is a combination of magnesium and citric acid. It reduces the size of the kidney stone so it can pass more easily. It's a solution that's instilled into the bladder. So even though this looks like it's an IV, it's not for IV use. This is an irrigation. So they're going to use a catheter to flush it through. The magnesium replaces the calcium in the kidney stone, and then it dissolves in the acidic pH environment created by the citric acid. And what's left over is broken down and can easily pass in the urine. Tiopronin, thiola, helps prevent the formation of kidney stones. So if somebody's prone to them, they may be on this medication. Urinary tract antibiotics are used to treat pyelonephritis and infections in other parts of the urinary tract, and I'll talk about those a little bit later on. And the urinary antispasmodic drugs treat spasms and pain caused by the kidney stones or a urinary tract infection. So the most common one is actually an anticholinergic drug. This is hyoscyamine, which is known as anaspaz. An means without, a spaz, so it's stopping the spasm. So hyoscyamine is the generic name. So this is going to help with pain and spasms caused by either the kidney stone or in the kidney or in being passed through. Diuretic drugs are used to reduce fluid. There are three main pharmaceutical classes of diuretic drugs, including loop diuretics, potassium-sparing diuretics, thiazide diuretics. Now, there are others. There are carbonic anhydrase inhibitors, which we've talked about previously. Now, in treating hypertension, back in Chapter 7, I talked about potassium-sparing drugs, spironolactone, and I talked about hydrochlorothiazide. So that's why I have this chapter in with the cardiovascular and the blood drugs, because there's a crossover. But this is also the bridge to the next unit, which the next chapter we're going to cover is going to be reproductive or endocrine and then reproductive drugs. So there is a connection there as well. All right, so first are the loop diuretics. Loop diuretics block sodium and potassium from being reabsorbed from the filtrate back into the blood. They act on the proximal convoluted tubule. So back here I have this image. This is called a nephron. This is located in your kidney, and this is where the filtration occurs. And then the filtrate gets passed through this tubular system and then becomes part of the urine. So this part is the proximal tubule. This thin area is called the loop of Henle. This is where your loop diuretics will work. And then we have the distal tubule. So going back, your loops, they're going to act at the loop mostly, but starting in the proximal. That loop of Henle, as we saw that again, it's very narrow, so it's very got a thin membrane, so a lot of things can pass back and forth, and we see how it's very closely interconnected with capillaries with the bloodstream. So even though we have filtration here, there's still secretion and reabsorption going on throughout the whole process. Now, more sodium and potassium than usual are excreted in the urine, and therefore more water. So how a loop diuretic works, it's very potent. It pulls the sodium and the potassium, and wherever those salts go, so does the water. So if you think about something very salty, it makes you very thirsty, right? Wherever there's salt, you want water to dilute. So the loop diuretic is going to keep the sodium and potassium going through the tubules to be produced in the urine, and water is going to follow it. So it helps pull the water. Now, we are excreting sodium, but we also will excrete potassium, and sometimes that can result in hypokalemia, a deficiency of potassium. So a patient must take potassium supplement to restore that balance, because if we don't have enough potassium, we're going to have problems with not just our muscles, but also our heart. So the drug, the most common or prototype drug is furosemide. Furosemide is known by the brand name of Lasix, as we see highlighted here. Couple of things. Patients shouldn't take diuretics into the evening because they would be up going to the bathroom all night. So think of this as last dose at 6, so that they don't have what's known as nocturia, having to get up and go to the restroom in the middle of the night. They do say that there is a drug stem of furosemide, butanide, that doesn't have the semide in it, furosemide. But again, be aware that use of furosemide or any other loop diuretic could cause hypokalemia, because the patient, along with that fluid, potassium is being excreted as well. Now, your potassium-sparing diuretics are going to do the opposite. They're going to keep potassium, right? They're sparing. They're keeping the potassium in the body. So they actually work in 2 different ways. They block sodium channels in the wall that keep sodium ions from being reabsorbed from the filtrate into the blood, but it's selective. It won't take the potassium. And they also block a hormone known as aldosterone that's produced in the adrenal glands that normally would move the sodium ions back into the bloodstream. So when a potassium-sparing diuretic blocks aldosterone, more sodium ions and fewer potassium ions are excreted in the urine. Both drug actions increase secretion of sodium in the water, but they spare or conserve the potassium ions. But because they're sparing it and we're also losing fluid, it can make the levels appear to be elevated. So it could cause increased potassium, which is known as hyperkalemia. So we've seen the drug before. The brand generic name is spironolactone. It's sparing, and its brand name is aldactone. Now, again, it's sparing the potassium from being excreted in the urine and moves it back into the blood, so it can cause hyperkalemia. Patients need to be aware of that and avoid foods that are high in potassium. So a lot of salt substitutes use potassium, bananas, certain nuts, the skin on a baked potato is very rich in potassium. So we don't want them elevating that potassium level even more, because that too could cause problems with the heart rhythm. And then we have thiazides. So I talked about thiazides as an additive agent in for treating hypertension, often given with an ACE inhibitor or a ARB. But they work by blocking sodium and potassium from being reabsorbed from the filtrate, so they get passed out with the urine. More sodium and potassium get excreted, the water goes with it. The drug stem is going to be thiazide. So our prototype is hydrochlorothiazide. We often abbreviate it HCTZ, and it's going to have that drug stem of thiazide. But it also, like the loop, could cause hypokalemia. We're passing the potassium out with the sodium and the water. Now, there are other types of diuretic drugs, and these include osmotic diuretics such as mannitol and carbonic anhydrase inhibitor drugs, acetazolamide, and both are used to lower intraocular pressure in the treatment of glaucoma. So we'll cover that in chapter 15. And then we have combination drugs. So a combination potassium-sparing diuretic, spironolactone, and triamterene, that's not in this image, with or triamterene, I should say, with a thiazide. So here we have spironolactone with hydrochlorothiazide, and spironolactone is aldactone and hydrochlorothiazide, so it's aldactazide. So they merge the two words. So we also want to think about this, right? So spironolactone is potassium sparing, it keeps potassium, and hydrochlorothiazide increases the excretion of potassium. So by putting these together, it kind of normalizes those potassium levels. Now, potassium chloride drugs are potassium chloride. So the abbreviation for potassium chloride is KCl, and the chloride, it's capital C, lower L, lowercase l. That's not an I. So it's KCl. And again, potassium elemental symbol is K. So brand name Chlorcon, and they use the capital K for potassium chloride, kind of merging it together. These are often prescribed to patients who are taking loop or thiazide diuretics so that they don't have excessive loss of potassium. They're available in liquids, although they don't taste very good, powders, effervescent tablets that have to be dissolved in water, capsules, tablets. And the one thing to note is these are generally going to be dosed in what's known as a milli equivalent. So if you remember way back when we first started learning about pharmacology and I talked about the different units, I think that was chapter 3, milli equivalent. Now on your labels, it will often tell you the equivalent dose in milligrams. This is an extended release formulation. Now, even though there are foods high in potassium, like most people think bananas right off the bat, usually when patients are taking loops and thiazides, that a banana is not going to be enough to elevate those potassium levels. They will actually be on a potassium supplement. And it's important because low potassium levels can lead to life-threatening cardiac arrhythmias because the electrolyte potassium is crucial to normal contraction of the heart muscle. Moving from the kidneys to the bladder is an expandable reservoir for temporarily storing urine. Diseases and conditions that affect the bladder include urinary tract infections, urinary tract pain, urinary retention, and OAB, which is overactive bladder. Drugs used to treat the bladder include antibiotic drugs, urinary analgesic drugs, drugs for urinary retention, and drugs for OAB. So talking about infection, urinary antibiotics are often used. So a urinary tract infection is commonly referred to as a UTI, and it can affect any part of the urinary tract. But cystitis, which is the infection of the bladder, is the most common type of urinary tract infection. The drugs that we're going to use to treat them are going to be antibiotics, and the more common ones for UTIs include aminoglycosides, cephalosporins, fluoroquinolones, folic acid antagonists, which include the sulfonamides, as well as other drugs and combination drugs. So aminoglycoside antibiotic drugs are used to treat many types of infections, but this drug is only used to treat complicated urinary tract infections, including pyelonephritis. Cephalosporin antibiotics are used to treat urinary tract infections and many other types of infections. We're going to talk more about these antibiotics in Chapter 9, so I'm just doing a quick overview of what drugs, what classes, not even a lot about the drugs. We do use the cephalosporins to treat complicated UTIs, including pyelonephritis, and they do have a drug stem. So if it starts with Ceph, and it's either spelled CEF or CEPH, it's going to be a cephalosporin drug. Fluoroquinolones are another class of antibiotics used to treat UTIs, and we will identify these drugs using the drug stem of floxacin. So ciprofloxacin, or Cipro, would be an example of a fluoroquinolone used to treat a UTI. And then folic acid antagonists, which include the sulfonamide drugs, they block the formation of folic acid in the bacteria. The most common one is going to be, again, these sulfonamides. So we're looking for sulfa, but not all of them have sulfa in them. Oops, I thought I had a picture. I did not. Okay, so sulfadiazine is one of the drugs, and then we also have trimethoprim. I'll be honest, one of the more common drugs is going to be sulfamethoxazole with trimethoprim, and that's coming up on a future slide as a combination drug. And then other antibiotic type drugs, they have unique therapeutic effects in treating urinary tract infection. The drug is nitrofurantoin. The only indication for this is for a urinary tract infection. So this is a specific antibiotic used for UTIs, no other use. Nitrofurantoin comes by brand names Macrobid. And when we say that, we know that it's taken twice a day for BID. Macrodantin is another brand name. And then our combinations. So again, this is a combination of trimethoprim and sulfamethoxazole. Both of these are drugs are folic acid inhibitors. It's kind of hitting it with a 1-2 punch. So this combination has a lot of different brand names, including Bactrim, Septra, Cotrim. There's a bunch of different ones. Now, it also comes when a doctor is writing for it, they will usually write the brand name because it's a combination. They may put SS after it, which would mean single strength, which would be 480, or they would put DS for double strength, 800, 160. They don't actually write the strength itself. They write SS for single strength or DS for double strength. Now, cranberry juice can be effective in preventing urinary tract infections. Cranberries are acidic, but it has an important therapeutic effect. Cranberries temporarily increase the acidity of the urine, which suppresses growth of bacteria because bacteria like a more alkaline environment. Also, cranberry juice contains the simple sugar fructose, which acts as an anti-adhesion factor. So the bacteria can't stick to the bladder wall. You want a true cranberry juice, not a cranberry juice cocktail, which is going to have more sugar in it, which may not be fructose. But cranberries, they do come in tablet form. So people who don't like the taste of cranberries or cranberry juice can opt for an over-the-counter cranberry nutritional supplement. Now, often with a urinary tract infection, there's going to be pain. Sometimes it's painful urination. Sometimes it's a burning feeling. So urinary tract analgesics will treat the pain and burning associated with a UTI or if there's been urinary tract surgery. These are oral drugs. They have a local pain-relieving effect directly on the mucous membranes of the urinary tract infection. Phenazopyridine is well known for turning the urine a red-orange color. So phenazopyridine is the brand name. It actually has phenothiazine, not phenothiazine. Chemistry is failing me right now. Yeah, I'm not going to go there. Okay, so it's got an indicator, and when the urine gets acidic, it turns pink. So phenazopyridine, sometimes known as azo urinary pain relief or prescription strength is pyridium, it can turn the urine red-orange. Now, if somebody's got a urinary tract infection and they see their urine is red-orange, they might think that they're bleeding. Phenolphthalein, that's the word I was thinking of, phenolphthalein. If you've ever taken a chemistry class and you were looking at it when the pH changes in a solution that's clear, you put a couple drops of phenolphthalein in it, and when it turns, the pH turns, the solution just turns pink. anyways, I jumped off that subject. But going back to the phenazopyridine. If somebody's urine is red-orange and they have a UTI, they might think they're bleeding. So they need to know it's the medicine. It's not that anything is wrong with your urinary tract. Now, the thing is, that color is affecting anything that there's water. So if they sweat, it's going to come out in their sweat. So if they're wearing a light colored shirt, it could stain it pink. If they wear soft contact lenses, it could actually stain the contact lens. So the patients need to wear their glasses while they're taking this medication. Now, in your notes that I've given you, it's asking what drug could turn the urine blue-green. Now, it's not a urinary drug, but actually the antidepressant amitriptyline and also the GI drug, the H2 blocker chimetidine, can turn the urine blue or green, as can methocarbamol, which is a muscle relaxant, robaxin. So we're talking about urinary system, but other drugs that treat other things can change the color of the urine. Now, urinary retention occurs when the bladder is not emptying properly. So we're going to use drugs that stimulate the parasympathetic nervous system, the rest, digest, and pee side of the nervous system. This will help contract the muscle layer around the bladder and begin urination. These drugs are used to treat neurogenic bladder, which occurs when the nerves to the bladder do not respond correctly to the expansion of the bladder. Then urine gets retained and the bladder becomes overextended as the patients who have multiple sclerosis or spinal injury. So the drug in this group is bethanechol, and its brand name is uricoline. So it's a cholinergic agent. So we've got that choline here. Bethanechol, choline. How I remembered this when I was learning my drugs was I knew a guy named Yuri, and I have a friend named Beth Ann, and I say, Yuri, give bethanechol. And that was my way to remember. Silly little ways, but there's a lot of drugs to learn. Now, urinary retention is when you can't go, and overactive bladder is when you always need to go. So this is characterized by involuntary contractions of the bladder that produce symptoms of frequency in urination, or a sudden intense urge to urinate, or what's known as urge incontinence, which can result in urine leakage. This condition often occurs in women during menopause or after giving birth. It occurs in both women and men due to age, obesity, diabetes, or neurological diseases. Overactive bladder can be helped by dietary changes, avoiding spicy foods that could inflame the bladder and trigger contractions, by limiting intake of coffee, tea, or sodas, because caffeine can stimulate urination. They're actually diuretic in effect, and avoiding carbonated drinks, chocolate, and citrus fruit. If dietary changes do not control symptoms, then overactive bladder is treated with anticholinergic drugs, beta-3 receptor agonist drugs, and neuromuscular blocking agent drugs. So anticholinergic drugs block acetylcholine. Again, acetylcholine is necessary for contractions. So if we block it, we don't get contraction. We don't get the bladder to contract. It causes smooth muscle relaxation, and anticholinergics also decrease bladder irritability and contractions. Darafenicin is an Ablex. It blocks the action of acetylcholine to treat OAB, but its common side effect, anticholinergic side effects, blurred vision, dry mouth, urinary retention, and constipation. Oxybutynin comes in 3 different forms to treat OAB. Here we have Ditropan XL, that's an extended length tablet. It's taken orally, it works systemically. It's also available as Oxytrol, a transdermal patch. It's applied to the skin. It also has a systemic effect. And then Gelanique, which is applied only on the upper arm, stomach, or thighs, and it works also systemically. If using the gel, it should be applied to a different site each day. And it's important to note, if a patient is using the gel, they shouldn't smoke because it can actually catch on fire. That's kind of a scary thought. Again, anticholinergic drugs have anticholinergic side effects: dry mouth, urinary retention, constipation, and blurred vision. And those can be concerns, especially for the elderly, because they can lead to falling. Newer drugs used to treat OAB include beta-3 receptor agonists. So these are going to activate the beta-3 receptor, stimulate those. They're located in the bladder wall, and this causes the bladder muscle to relax and allows the bladder to fill more fully before it contracts again. The drug is mirabegron, which is known as Myrbetriq in the TV commercial. I just love that little bladder guy who goes around on the TV commercial. I love all the little animations. I know it's not this chapter, but the Chantix. I said that when we did respiratory. Other drugs used for overactive bladder include neuromuscular blocking drugs. Now, these come from the neurotoxin produced by the bacterium Clostridium botulinum. The drug is injected into several different sites into the bladder muscle, and it relaxes the muscle, decreases contractions, and allows the bladder to fill more fully before it will contract. This drug is used to treat patients who didn't respond to the anticholinergic drug or the beta-3 agonists, or who could not tolerate anticholinergic side effects. So we've talked about this drug twice already. We talked about it with migraines, and I'm going to say muscle spasms. So onabotulinum toxin A is known as Botox, and they can inject this into the bladder so that it won't continue to contract as much. Okay, so the last part of this is the prostate gland. So the prostate gland is only in men. It's a donut-shaped gland that encircles the urethra. It's located at the base of the bladder and surrounds the urethra, and its function as part of the male reproductive system is to release prostatic fluid into the urethra. This fluid, along with the fluid from other glands in the male, make up the semen. And diseases that affect the male prostate gland include benign prostatic hypertrophy. So this is non-cancerous, benign, and it's overgrowth. So the prostate gland has swollen. BPH is common in men over the age of 50, with the incidence increasing with age. The prostate gland enlarges due to a chain reaction in which male hormone testosterone is acted on by an enzyme known as 5-alpha reductase. In the prostate gland, it is converted to dihydrotestosterone. The DHT that causes the prostate gland to grow. This enlargement is non-cancerous, and symptoms include difficulty initiating urination hesitancy, which means they kind of start and stop urinating, and decreased urinary stream. Patients may be reluctant to mention urinary changes to the healthcare provider. And the drugs we use for BPH include 5-alpha reductase inhibitors, as well as alpha blockers and PDE5 enzyme inhibitor drugs. So 5-alpha reductase inhibitors are going to block that enzyme that's going to convert the testosterone to the DHT. These drugs need to be taken for 6 months in order to see an effective decrease in the size of the prostate. These are sometimes also referred to as androgen inhibitors because they're inhibiting testosterone changing into the dihydrotestosterone. So they're blocking the male hormones. The the generic name here is finasteride. The trade name is Proscar. This was the first non-surgical treatment for BPH. It's also sold under the brand name of Propecia, which is taken orally for male pattern baldness. Alopecia is loss of hair. Propecia, it's growing. So the hormone dihydrotestosterone can also cause male pattern baldness. So when we're looking at this, the drug stem is asteride. So again, a 5-alpha reductase inhibitor is sometimes referred to as an androgen inhibitor. Now, it's really important to note, anybody who potentially is handling these drugs, because they are inhibiting male hormones, a woman of childbearing age should not touch or handle any broken or crushed tablets because it can be absorbed through the skin and can interfere with the development of a male fetus. Now, asteride is going to be your drug stem or your 5-alpha reductase inhibitors. Alpha-1 receptor blockers or alpha blockers we've talked about for blood pressure and other uses. There are some that are only used for BPH, and there's some that can be used for the heart and for BPH. They're going to block the alpha receptors in the smooth muscle of the bladder and the prostate, causing the smooth muscle to relax, which allows the urine to flow more easily through the urethra. Because there are only a few alpha-1 receptors in the neck of the bladder that are blocked, these drugs do not relax the bladder sphincter or cause incontinence. Therapy can start as early as 2 days, but take as long as 2 weeks to be seen. So silodosin is Rapaflo. And again, your alpha blockers end in osin. And Rapaflo, it helps them get a good flow rapidly because they're having a hard time urinating. And then your PDE5 inhibitor drugs, which are also used to treat erectile dysfunction. We'll talk about that in chapter 14. These PDE5 inhibitors relax smooth muscle layers in the bladder and the prostate and allow urine to flow more easily. Tadalafil is the only drug indicated for BPH of the group, and the rest of them are used to treat ED. So Tadalafil is known by the brand name Cialis, and I don't have the pop-up on that, but the drug stem is Afil. So your PDE5 enzyme inhibitors end in Afil. And then we have combinations. So this is a combination of a 5-alpha reductase inhibitor, dutasteride, with an alpha-1 receptor blocking agent, tamsulosin, and it's used to treat BPH, and the drug name is Jalin. Now, just a little note, there are alternative treatments with nutritional supplements to treating BPH. So saw palmetto is a small palm tree. It's native to southeast U.S. Its fruit was used by the Seminole Indians to treat genitourinary conditions, and it's available today as an over-the-counter dietary supplement. It can be purchased without a prescription, and it's popular for treating BPH, although research studies have not shown it to be effective. All right, let's finish up those questions.